Hey everybody, thanks for joining us this evening. My name is Scott Kovner and welcome to the EMRAP New Attending Launchpad event. This is a new event that we're doing. Congratulations on graduating, whether you're graduating from residency, fellowship, or you graduated and you're a PGY 26 and you're just looking to start a new job, I guess, and joining us a new attending with us. We're here in our studio and we're really excited to have you here. We hope this will just be a really great conversation to give you a really good and detailed look into life on the academic side of emergency medicine, on the community side of emergency medicine, a 360 view from nursing perspective, from a recent grad perspective of, what it's like to take on that next part of your career, that next start of the journey, and hopefully have a lifelong set of success and happiness. But enough blabbering. My name is Scott. I'm going to go around and introduce our amazing panel of people here today. Jan, why don't you kick us off? Who are you? What do you do? All that fun.
My name is Jan Schoenberger, and I'm the Vice Chair of Operations and Education at USC.
Boom.
Great.
All right, Adam.
Yeah, I'm just a humble ER doc over here. No, I'm honored, honestly, to be here. Thank you so much. I mean, to be sitting here with, my old, mentors, Jan, Kathy, and to meet new friends, Scott. It's great, fantastic. But I'm a LA County grad, 2019, and fortunate to be working in the community in San Diego. And just like I said, happy to be here.
Wonderful.
Yeah.
All right, Kathy.
Kathy Garvin. I'm an emergency nurse, been there about 20 years at County, and I'm the day shift supervisor and love my job and get to work with all of you. Life is good.
Yeah.
Thanks for being here. And Scott.
Yeah. Hey, everybody. Thanks for having me. Appreciate it. Scott Brewster. I'm the Chief Medical Officer for Emergent Medical Associates, and we are mainly in Southern California. We have about 28 different emergency departments, mostly community-based, all the way from single covered to very, very large trauma centers. And we've onboarded a lot of new graduates, so hopefully I have something to share as we go forward here.
Yeah. Thank you so much for taking the time. Freshly off shift, I might add.
Yeah, absolutely.
Respect for doing it.
Yeah. And I survived. I survived.
Well, let's jump right on in. Please, if you have any questions in the chat, we're going to be feeding them live, but we've got some ones that we thought that you might want to know about, and we're really excited. So maybe, Adam, I'll throw the first one at you. So
Have it.
You're 2019 graduated, right? So been out for a few years.
Yeah.
What was some of the most surprising things about being a brand new attending out in the big world?
Yeah. I think there are a lot of surprises, a lot of good ones, and I would say mostly really good. And I can just say from experience, I know there's a lot of, kind of things that will come up with any person kind of graduating into the next steps and going out into the community or any attending job for that matter. But I kind of felt when I first got out, kind of like the dog that was chasing its tail for the longest time, and then you finally kind of catch your tail and you're don't really know what to do with it anymore. For me, medicine and for all of us, it's such a dedication and grind, and you kind of just internalize that into a lifestyle. And you're working really hard, and you're thinking, breathing medicine. And then when you're done and you're kind of working in the community and you're scheduled, fortunately a little bit better, and you're like, what's free time? I have this free time. And but just kind of being able to kind of rethink how you want to live, what's important to me, what do I want to kind of continue my career as? Do I, family, hobbies? There's so much amazing things that are in the next steps, and really you have all these different options, and it's a beautiful thing. And I think that really surprised me initially, was having those moments where I'm like, oh, I could do all these different things. And so that was a beautiful thing. A little anxiety provoking in the beginning, but once you kind of really have time to look into yourself and really kind of focus on what you want in life, it's a great transition. Yeah,
especially when you have a little bit more time to do that.
Yes,
from going 23 shifts a month.
It was so hard having all this extra free time. It was good. I mean, there's been obviously a lot of surprises down the road, and interacting with the team in a new environment. Obviously, there's some challenges there, but being able to just kind of really get into a new space where you can be there, long term, develop kind of a new, work family, and really get to know your colleagues really well. It's been very good, very good. Yeah.
Scott, do you remember what was the most surprising thing for you? coming out? Because you were just telling us before, you basically did 2 residencies. You were in it for a while, so it was
I was in it for a long time.
One wasn't enough.
Being a little OCD myself, I think we're all used to those. Once you come out, you're used to those blocks: 4 years of college, 4 years of med school, then you do 4 to 6 or 7 in residency, and now going out into your first couple of years, it's anxiety provoking to now go, okay, what am I going to do? Mm-hmm. And I had a lot of stress on, is my first job going to be my only job? Mm-hmm. And I want to get it right the first time. And I think one of the things when I think about, and I talk to a lot of the people starting, is I think there's something to say about when ACEP says, most of us as emergency physicians are going to change jobs 3 times within that first 5 years. And I think that's really important because, we don't go in and we don't take a group of patients with us. What we do is we have a job, and what we have to be is dedicated to the group that hires us. But most groups just ask you to do, 90 to 120 days, as long as it gets you on staff, someone else on staff to take your place. And there's a freedom to that. And I think we all want to be in the right job, but it doesn't always have to be the first time, because you've got to kind of figure out what kind of practice environment you're in, the people that are around you. Every group has a little bit different value and different twist. Every emergency department has a little bit different twist. Do I want to be in a small ED, a big trauma center? Sometimes you got to feel that out coming out of an academic residency. And so that was my biggest stress. And so I jumped around a little bit. I went from academia, I went to big trauma center, I went to small sites, and then I finally found my spot. And I've been there for 20 years, so it's been great.
And did you know pretty early on in those times we were jumping around, like you're like, this is not the spot for me, or this, I could do this for a bit. Like, did it, how did that process kind of go?
Yeah, that's a great question. So I think, and especially being on this side of it, it's important that everybody spends enough time at a site, because it takes a long time to learn the system. And once you learn the system, then you're practicing the medicine. And once you're practicing the medicine, then you kind of understand if that's the right place for you. And I think that does. It takes a little bit of time. So for me, I didn't know. I was excited. I think Mel's the one who got me out of academia and said, you got to get out of here. You got to go do that other stuff. Give it a try. And so I did the academic part. And I loved it. And then I worked at Cedars-Sinai with a wonderful group of people. And then I got really kind of interested in leadership in community-based practice, based on something actually that happened to my family in emergency medicine. And all of a sudden I went and did that, and I found my home. So I think you've just got to have open eyes and to be willing to have some change early on, and then you'll find where you want to be for the rest of the time.
Yeah, that's great. It's always, when you hear that ACEP statistic, it's like, because, no other part of your medical training, they're like, you might try 3 medical schools, maybe 2 residencies. It's right. I like how you said that you've always been on that path. And so it can be very alarming to kind of like, I might not actually like this job that I worked so hard to get that interview for, or whatever, they have Epic. I hate that. I got mad at you. I'm almost Cerner guy. Jan, how about you? Do you remember anything that really surprised you in those first few years out? You were like, wow, I was not expecting this.
Well, I think academics is a little different than jumping into the community. The first, when I got out of residency, I did both for a while because I didn't know what I wanted to do. So I took a full-time academic job, but I also took a community job. Because you're so you're just uncertain at the beginning. Absolutely. You have a lot of questions about what's right for you because it's a long road. I think that Scott's point's a really good one. A lot of residents and fellows who are about to go out that I talk to are very nervous about this first job decision. Is this the right one? But I tell them the same thing. I'm like, it doesn't have to be the right one. This isn't residency. You don't have to be there it's not prison. You can leave. And if you don't like it, you have control. Absolutely. As long as you leave in a good way, you don't screw over a group that had invested in you. Yeah. It's okay. People understand that this might not be right for you, and people want you to be happy. Right. So when I first started, I did both because I was kind of like covering all the bases. And I just worked a lot. I felt like I didn't have a lot of free time. For a while at least. But that was my choice. Yeah.
And do you remember what tipped you over to be like, when you were doing both, like, actually I want to be more on the academic side of the fence here? And
I did the community thing for 5 years because I actually I was learning a lot. I mean, I found that on those shifts, I was learning a ton. My learning curve was, you know the medicine, but you don't know a lot about a different healthcare system. You just learn so much about what it's like to get along there. That I just felt like I was learning. So I just kept going even though I had kind of decided what I wanted to do. But after about 5 years, then I felt my learning curve was plateauing a little bit and I wanted a little more free time. So I kind of cut back.
Yeah.
So you then decided to run a program, a residency program.
Yeah. A lot of free, lot of free time there. A lot of free time.
Poor choice.
And, Kathy, like, what are you most surprised by when you see new attendings kind of come on? Because you've seen so many people come in as their first gig out of residency, or like even people who are just coming into county now as like a new attending that might have practiced somewhere else. Are there any things that you are immediately surprised by, or you could tell like, that's a new attending, something like that?
No, actually, I can't always tell because we're a training program anyways, because we're academic. We have so many new residents all the time that I can tell the difference between a confident attending and probably a brand new attending. Yeah, the ones that introduce themselves and make their presence known. That usually signals that it's not their first gig. And the ones that are kind of more in the corner and I can't tell, I have to fill out whether they're a resident or the attending. I just know it's a new face when I introduce myself. But I can tell. I'm always happy when I see our own residents come back as attendings, and many have hit the community and then found out kind of what Jan's saying, that out there they don't have a team around them that knows the answer to some things, and they come back for fellowships or as attendings just to really kind of hone their skills because they don't want to be the only expert out in the field. And so
I want to stick with something you said at the beginning there that I found really interesting. So like, what are some of those things that help you define that confident, attending that you feel like the whole team can kind of get behind that just comes on, versus that one I think you said was like kind of in the corner a little bit? Because I feel like the hardest part that I've seen, like going into a new role as the attending, like even in maybe a per diem situation, or it's like a new hospital, like you show up to shift, no one there knows you, and you're expected to there's a cardiac arrest in 10 minutes, lead that entire team of people and have them trust you in 1 minute. I always found that very stressful, especially if that first shift is you're walking into a hot mess as your first time meeting those people. So what are some of those things you're like, I could trust this person, that immediately created that bond for you?
Is introducing themselves. Introducing themselves and their role, and maybe a quick story or something just to kind of make it known that you're a real person and that you're happy to be here. Because it's challenging. How are you going to know how the nurses are going to react? What kind of people that you're in with? You didn't choose your team. This is who you have now. But really being able to just say, this is who I am, give me a good story, and this is what we got coming in, and let me know if if you want to jump in and tell me I'm doing something wrong, great. And I think every nurse will follow you. I think every nurse, if you just say, this is who I am, brand new here, but happy to be here, and let's do it, nurses will jump in.
That's awesome to know. Yeah. Simple things. Those are the things that really make the difference.
Oh, absolutely.
Yeah.
Scott, can I parlay off that?
Please, yeah.
Just because, I think that's so important. One of the biggest mistakes I see is that because it's so stressful when you go to a new site, Jan and I know it used to be very easy to start an emergency medicine site. You would get out a blank sheet of paper that said orders, and you would write your orders and you'd give them to a secretary. It was the same at every site. Now you got Cerner, you got Epic, and they're all different versions, and you got, all the documentation. So all the stuff that makes everybody, bright-eyed. And then you're just trying to concentrate on the medicine, and you forget about the relationships and the people. And the relationships and the people, the nurses are your eyes and your ears from day one. And if you want a successful transition, you need to even not just show up on your shift, but go during your mentor shifts or your shadow shifts and meet everybody. And you can ask one of the docs is, who's the most important, what are the 5 most important nurses to meet? Go meet those people. Know your ultrasound techs, your x-ray techs, your unit secretaries are probably the next most important group. And if you can get those relationships early on, then they'll help you kind of flounder along and make it easier for you. So really, really important.
Yeah.
That is such a great tip. Asking one of the other docs or another staff member, like, who do I need to know? Who are those key people? Because I think like after like 1 or 2 shifts, you kind of figure it out, but it would be nice to have that on the front end and walk into that. Jan, what do you think about when you are transitioning? Maybe it's you're going to fellowship, or maybe you got hired right out of residency into an academic faculty. Like what are some of the things that you might not have learned in residency about being a member of an academic faculty that make that a different gig than just showing up to shift and what you have to deal with there?
Yeah, I think in academic department, it's about all the other stuff. It's probably the easiest part is the showing up to a shift. I mean, you have your own challenges, which we're talking about, but it's figuring out what the expectations of that job are outside of the shifts, because you get your schedule, you're like, perfect, you map it out. But like in academics, there's so much more homework, how many residency lectures am I supposed to give? How many evals do I need to do? What does the chair expect of me? What kind of scholarship do I have to put out? All those kind of other things that you're supposed to do, just like those are job expectations. Just know what they are, try to plan for them, map that out. And I also think, we have to mention your first year out, whether you're community or academics, you have to pass your boards.
Oh yeah.
And that's important. You don't want to put that too far down the list, because, that I've also, seen the occasional grad that we've had that hasn't passed because they kind of de-emphasized it. They sort of took it for granted that they would probably pass, and then find themselves not passing. And then they put themselves in that bucket of stress. And, so I think that's in the first year. I think most of us bosses, we expect that people pass their boards, and we want you to do that. So.
Yeah.
Right?
Yeah, that was an expectation as part of the contract, really.
Yeah. That's a tough back to work day after, not
a lot of cash to burn too. Go through it twice.
But I can see how like you're out of the mindset of being a student anymore. You've like now actually have time to like get coffee with friends and like to do real adult things, it feels like, and you can kind of lose track of that. Yeah. When you would sit down, let's say with like a fellow or like a new junior faculty member after like a year, what would success for that first year look like? Obviously passing the boards, not getting every resident complaining about that person, but are there any other things you're like, wow, I'm going to put a little check mark asterisk there that they did a great job?
I think by the end of the first year, you should have, some projects in the hopper. You don't have to have published something, but like have an idea of something that you want to work on. Maybe you're on a committee or two, you've volunteered for a couple things, said yes to a few opportunities. I mean, after a first year, if you can pass your boards and do a few of them, I don't think that the expectation is a lot higher than that. And not have complaint letters. I mean, whether you're, again, like no matter what job you're at, complaints can come. Yeah. So you want to be on the side of, maybe you had a compliment, but certainly you're not being called into somebody's office or having questions about cases that you've been involved in. So flying under the radar administratively would be a good thing too. Answer your emails, that kind of thing. Yeah.
And how about from your perspective, Scott, in the community, like if you just have hired some new peeps to your site, like you're at that 1 year evaluation point, like are there any different things that you're really looking for or hoping for from those new grads that you're like, you were a stellar performer and clearly someone that's going to advance in our group?
Yeah, I mean, I think the most important thing is to be that active learner early on during those first couple months where you're actively trying to assimilate into the culture of the site. And when I say site, that would be the hospital itself, and then assimilating into the group and whatever, is important for that group at any given time, that you are excited, eager, learning, and engaged. And, most sites have different things that they look at you for from an efficiency standpoint, from a billing standpoint. You're documenting okay. You're not one of those people who are going on probation at the site for not signing all your charts. You're showing up on time. You're putting in your schedule on time. I mean, really basic citizenship. And then you're slowly learning and picking up as it pertains to your efficiency. And you're always concerned about quality, even if it's a problem with your efficiency. And then you're humble. And I think you said that word at the very beginning. And what I mean by humble is that you're not righteously indignant. You don't get there and you're scared to ask questions, because I think we're all in this for lifelong learning. And if you're asking questions, then you're asking the people around you to help you and lift you up. And those are the people I find that are most successful at a year. The ones that get themselves into trouble are the ones that I think they're going to think bad of me if I ask this question. And all of a sudden they go the wrong way for a case, or, their interactions are not appropriate for the site, and they get themselves into trouble. So be open and be humble.
Those are pretty widely applicable and sage pieces of advice. Yeah. Adam, when you transitioned into working at San Diego at Sharp, what were some of the things, Scott just talked about this idea of like a good fit for the site, and then kind of like this idea of this community that you're joining. Were there any challenges that you felt leaving a residency community and kind of integrating into that new community that you're trying to build there?
I mean, it's such a blessing for me to be at a shop that actually a lot of my seniors were at. So there's a big kind of population of people that were not only trained me, but so I'm coming into this site where it's people I used to present to as essentially my seniors, and then now I'm working and assimilating myself in the group. And obviously there, sort of feelings of kind of imposter syndrome, and how am I gonna present to Lee Plant Mason or Zach Shiner, like these big people, that were big kind of parts of me developing as a physician. But I think kind of what Scott mentioned is I think there's this sense of when you complete residency that you have to have it like, oh, I have it all figured out, like. No, there's still so much learning that happens, when you're out working, and it's really collaborative. And I think as long as you have the confidence to know that, hey, I know things, but also I have a lot to learn, but you have the confidence to ask questions and learn new techniques and learn how people practice. And you can also, I think we forget, like being just out of training, you also are very well, up to date with the newest things, the newest guidelines, so you'll find that your seniors, in the group that are really much more experienced than you, but they also will come to you for, advice on like, hey, what's the newest way of doing X, Y, Z? And so if you're, ask questions, make connections and make those relationships, you'll find that it's actually a wonderful thing.
Yeah. And I think that's a really important point to remember, that you, as the new person coming, you still have something to contribute that might be different than the person who's been there for like 15 years, who like might not know this technique about placing a central line or this literature. And that is a beautiful moment to immediately give value to the group and to that community that you're joining. I think it's easy to forget that when you're so intimidated by like, oh my God, this person's been doing this and they're teaching me all these things, that you still have something to share.
Yeah, absolutely.
We just got a question in from the chat. Jan, I'm going to throw it your way if that's okay.
Please.
Because I'm sure you've counseled recent graduates at some point on this. The transition between, like when you're, let's say, a hospital employee as a resident, and now you're becoming an independent contractor, trying to deal with some of that. What are some things that genuinely you have to think about? Besides, now you have to pay taxes, which is everyone's big forget when they're 1099. Like you can forget that.
Well, some of those practical things are really important, and we don't get taught them in medical school. I mean, we are famously like the worst business people. We know nothing about, when you are an employee, you get all of your retirement and insurance and everything is like structured for you. And moving into the world of being an independent contractor, where it really is up to you to decide how often you work and how you save money and how you get insurance and all these very practical things, but they're very important. And if you get too far behind and let years go by making mistakes, you can, so I think there's just a lot to learn on that front end about that stuff. I mean, I'm sure, I don't know in your big group, Scott, when you have people coming on, like how you teach them that business stuff. I felt like I did a lot of that learning on my own.
Yeah, we do. We actually have someone that we sit them down with and spend, it ends up being a couple hours because there's so much to go through and there's so many questions. It's different. It's different. And it's true. Most groups, when you come out and you decide to be a 1099 versus an employee, it tends to just be really a financial decision by the group. And, both the employee aspect and the 1099 aspect, they both have lots of pluses and they each have some minuses. And you got to know those because you can definitely manipulate those in your favor. But I think the most important thing is having a really good accountant coming out. And then, again, finding those people in the group that have been doing it for a long time, because there's always the people in the group that love the business aspect and have it figured out. So you don't have to reinvent the wheel.
That's right.
Yeah, I remember, Adam, when you were graduating, you were talking about getting an accountant.
Yeah.
And as like a resident, that's
Yeah.
like such a bizarre thought. Like, wait, you're telling
Yeah.
me I'm going to hire somebody to help me with my, like what they're managing my $1,000 that I have?
That was saying that you have an accountant is like the most attending thing you can probably say. Growing up, it's like, oh yeah, so I have an accountant now. You know, it's like, oh, I'm attending.
The junior
now.
attendant says like, oh, I have a tax guy. And
Yeah.
then it's accountant.
No, yeah,
that's
yeah,
like the next
accountant.
level.
Yeah.
But that's such an important thing to remember. Like
Yeah.
there's a whole other set of professional fields that like are now at your disposal that you can assist them for help, like getting a lawyer and accountant. Like maybe you might have to incorporate for your, you know, 1099 gig, and there's a whole bunch of other questions to ask about that. And it becomes, I think, really hard to provide the individual specific detailed advice because everyone's situation is going to be so different.
Yeah,
And
absolutely.
at that point, it's like kind of you versus like Uncle Sam finding the best solution for, you know, like your finances and your personal stuff. Adam, when you set all that stuff up, did you have a specific way of looking for people? Or I think Scott made a great advice of just asking those people in the group.
100%. So you know, like Jan said, you know, when we getting out of this training, you know, we know medicine really well, but you know, when it comes to finances, you know, unless you had an interest or some sort of background, you know, a lot of it is new. And I think this kind of tees into, you know, you're not alone when you go into your new group. You know, ask the people there that have been there for a while. I mean, the stuff that, you know, attendings out 10, 20 years know, you know, and the pitfalls that you could potentially avoid, you know, just by asking them questions. I mean, utilize that. That's a resource that you most certainly should utilize. So I kind of did that. As I joined, you know, fortunately I have a lot of mentors in my group. And so I kind of just asked around and say, hey, you know, what did you do to, you know, kind of to get things set up? And you know, fortunately, one of my, you know, other colleagues had an accountant that I, you know, ended up linking up with and have a great working relationship with. And it's nice to have, you know, if you have an accountant that kind of knows how you know, he works with many of other colleagues in the group, you know, it just makes things kind of a lot easier, you know, kind of going through, because they just kind of know how, you know, kind of the formula for success kind of thing. So I learned a lot through that way. And if you have a good accountant, they'll teach you a lot. You know, you'll ask questions and you'll learn a lot through that whole process. But I think the biggest thing is like not being afraid to ask questions and not being afraid to tap into, you know, the resources of your group and people with all that experience.
Yeah, and there's that certain like social awkward activation energy of asking about money stuff or accountant and help, but like it's just, you know, like you're an adult now. It's just boring. Like it's no longer talking about ECMO. It's about like, all right, who does your taxes?
But Scott's 100% right. There's always like one or two people in the group that are like why are you like, you're like, why are you even in medicine? Like you seem like you'd be more, you know, just the finance people like all like, oh, you know. And usually it goes hand in hand with like coding too. Like they just get really meticulous with certain coding things, you know. So it's good to know those people, you know, in your group and who you work with. You learn a lot.
Yeah. Oh my God. It's just not something I'd never be like super fixated on. I'm like the worst for thinking about the coding stuff. So I'm glad that those people are out there that you can like ask those questions to and set you up with. I'm the guy that's like, give me the name of the person I need to email for the account stuff. So, and for those of you who are watching and then maybe not in the US, like 1099 is like a tax form that's you're an independent contractor. And that's just the difference being like a W-2 employee, which is like a full-time employee that gets the benefits and they withhold your taxes. So sorry if that was unclear to anybody out there. Or we're talking about all these fun tax form numbers.
About how you get paid.
Yeah. All the fun stuff.
Fun.
That's what you have to look forward to on the other side.
Yeah.
But there's a lot of fun stuff to look forward to. So maybe, Jan, like what's something that you like really couldn't wait to do when you were in attending, like right on the other side? Is there anything that you were like teaching residents and being in that role or being out there for the first time, you know?
No, I was pretty terrified.
Yeah.
I don't, I mean, right. I mean, that first, that transition, the step up in responsibility, like when you really realize that it's like now the buck really stops with you. I mean, when you're a senior resident, like you're really good at what you do, but ultimately, you know, the responsibility is still your attendings, and you always kind of know that. And then you're the attending and you realize there really is no one else. It's the procedural aspect of it, it's the responsibility aspect of it that really that is going to stop with you. And if we can't get this airway or we can't figure something out, whatever, we run into even a systems issue that's going to fall on you to figure it out, navigate it. So it just opens up a lot of things. They're fun. They're opportunities, but they're scary. That's just the truth.
Yeah, I feel like the buck stops here mindset is like it. That's what I remember my first shift working at Good Sam. It's like I was like a low risk 20-year-old chest pain. It was like, they had been sitting in the waiting room. The tropes have been done for like 12 hours. Like they had stress tested themselves also outside doing like some jogging push-ups. And I remember just hovering over that discharge button, like something as like a fourth year resident, I would be like, oh my God, I can't believe the attending made me wait till it, and I was just paused and I was like, oh yeah, this is like entirely kind of on me now. Scott, how do you, how did you kind of cope with that? Or do you have any tips for the new grads for like getting through that in those first few shifts maybe in the community? Or, I know it's a really tough and there's no right answer, but.
Yeah, probably the thing I remember most, I was terrified. But the thing I remember most was one of my mentors taught me the thoughtful pause. And it's the thing that I've taken with me forever. And it saved me at that point, which was, the stress level in any emergency department and your pace just starts going like crazy. And to learn the ability to, just like you did, which is you did a thoughtful pause over that button. Yeah. You're like a 20-year-old with chest pain. What am I missing? Am I missing this dissection? I'm going to push this button and it's done and they're gone. And I think that's a really important skill, because when you don't do that, you're not kind of reassessing your thought process that may have happened while the nurse was coming to you with another sick patient, et cetera. So I've kind of taken that thoughtful pause and used it a ton, which is, hey, I'm about to go talk to this attending who I've had a bad interaction like 10 times with. I'm going to take a thoughtful pause and try to see how I can do this differently. Or I'm going down the road of this patient or this critical patient. I don't feel like I know what I'm doing. I'm going to step out of this craziness in my mind for just 30 seconds and readdress this. Or if it's a real critical patient, what I'll now do is make sure I document on them. And if I document on them, I'm going to go back through that whole case. And, 20 to 30% of the time, I'm like, whoa, okay, now that I read it, I just missed that large pulmonary embolism that I should have worked up. So for me, it was that thoughtful pause, and that's helped me to this day.
That's such a good point, because that's like all through our residency. Even I remember as a senior, like you're presenting really simple cases, and that's kind of baked in for you, because like you have to say it out loud, you have to think about it.
Yeah.
The attending who's supervising you gets a chance to like actually listen, and you do pause. But when you're just on your own overnight, 3 a.m., like you could just keep flying and never really stop and think unless you bake that in, that thoughtful pause. I love that.
Right. And I think on top of that, it's really important early on in your career to figure out, you're never going to be able to completely do it, but to try to contemporaneously chart on your patients. Start with the sickest patients. Anybody going upstairs, I'm going to contemporaneously chart. Then, the ones that I sent home that were relatively sick that I want to think about one more time, I'm going to force myself to chart. And I think sometimes, especially people coming out, what they do is they're there 4 hours after their shift because they got a stack of 40 different charts that they now have to go through and do. And that didn't help them with that thoughtful pause concept and going back through that patient. So
that's a really good point. It's really tough to stay up on those, especially in your single coverage. And, you kind of get a little bit more laid back in that third or fourth year as a resident. And now I'm like, oh, I got to keep up.
Yeah.
We just had USC graduation last night. And then now in, a few days' time, some people who had just graduated are going to be starting fellowships and now working attending shifts in the department that, they just graduated as a resident. Kathy, I know you've seen many people go through that transition between I was just the recess 2-star, as we'd say at county, or the senior resident, and now I'm putting on my white long coat for the first time in, 5 years or whatever to signify that transition. What are some features of people that do that really well? Like, how did they make that transition from like a resident right at that same program, and now you're in the captain's chair in a lot of ways?
I think when they're coming home, when they're back at county, they tend to be pretty successful. I think what I see is the nurses forgetting that they just graduated, and then have them deflate like immediately. They come in all excited to be the attending, and the nurses still think they're the 2-star. And so it takes a minute so that we're not just destroying, this terrified pride that they have. But
I love that phrase, terrified pride, your first 2 years out. That's such a beautiful way to summarize that. Yeah, that is great.
But I think the same thing. The human factor is just being like, okay, I've got my new coat on, and acknowledging it to the nurses and engaging them. I think that really the human factor, it's back to that again, just respectful communication, saying, help me if you think I need help. I'm still the same person. And luckily, when they are coming back to our shop, we already know their strengths and weaknesses. And so we know where to bolster them. And as long as they're showing that need for the nurses will step up. You know, they want to be part of the team. So that's super easy.
Yeah, having stayed on to do fellowship right after graduation, I found this to be one of the most challenging things to actually do. Jan, you saw me go through, you've seen a lot of other people. How does it, from your perspective, look to make that transition successfully, to go from just being a resident? Sometimes you're now the attending for somebody that was just your junior, 2 days before.
In most tough circumstances in the emergency department, keeping the patient in the center of it is always the answer. Just, it's a balance of humility and confidence. But if you just remember that we're all here for the patients, it's not about me being your friend. You're not here to be people's friend. You're here to be the doctor. You're here to be the steward of the resources to make sure this patient gets the best care. Anytime you put the patient at the center, whether you're arguing with a consultant, whether you're trying to figure out, what the right thing to do is, if you just remember why you're there and what we're there for, just recenter on that, I think you'll find the right formula for yourself. But, for the most part, I agree that there's humility and just good communication. But, don't try too hard to be everyone's friend when you have to be their supervisor at the same time. If you remember that it's about the patient, then you realize what the balance should be.
Yeah, I think that's a really hard thing, especially if you're super close to the class was underneath you, putting up you kind of have to put up that boundary where maybe the post-shift drinks, you leave, you don't go, or you leave, or really redefining yourself in that way. It can be really, really tough. And it's not something, because I think you worry a lot about the clinical moment, oh, they want to get the scan, you don't want to get the scan or something, but not really kind of the full regalia. And then kind of on the flip side, if you stay at your home institution, any tips for navigating where now you're kind of friends with the faculty, the people that just, raised you up, raised you through? It's tough. I know it's so different from person to person.
It's different.
But,
I mean, in some ways it's easier to leave, right? It's easier to go somewhere where they don't know you. It's harder to stay where people know you, and now all of a sudden you're this sort of artificial transition from, day 365 to day 1. But, I think you just be normal. I don't know. Yeah. I mean, these are all about just being normal and don't be weird.
Don't be weird.
Don't make it weird.
Yeah.
There's somebody home right now writing a note, don't be weird.
You don't need to act any particular way. Yeah. Just be yourself.
That was the thing.
Yeah.
I would like to emphasize what Jan said about the patient-centered perspective. Because that I think is really the keystone of keeping you really, on the right path towards your career and your life as a physician, because you'll have so many distractions coming in, as working and attending. You're suddenly just going to get EKG. Look at this EKG. I can't tell you how many EKGs I look at triage now. Obviously in the community there are metrics and your patients per hour and your door to needle times, and there's a lot of things that can really get in your headspace on shift, even, where you might even be talking to a patient and then you'll find yourself thinking oh, I need to do this other thing, or I need to see all these other new patients. And it can really, hinder you, and really, I think, not only affect your patient care, but your happiness in your job. So, remembering that, those metrics are important for quality. We want to make sure we're giving the best care for our patients, but we also don't want it necessarily we want it to emphasize and impact positively our care, not necessarily to distract you away from, being present in front of that patient in front of you. And also being patient-centered, and you mentioned this too, when it comes to consultants. And I think one thing, and during residency, you might be able to have a lively conversation with a consultant because they're also a trainee.
Lively, a very political.
And also the fact that that you're not necessarily going to have to work with this person for very long, maybe a month or maybe a year, who knows? But, they're not kind of necessarily a forever colleague. But when you're out in the community, especially if you're, find a shop that you like and you're going to be there long term, these consultants that you're working with, you're going to be working with them for years, all your career maybe. And And, if you allow yourself to get in discussions, if there's some disagreements and things, and you don't keep the focus on the patient, really it can make not only bad patient care, but it could create hardships, lifelong career hardships for you. So I think that's such a great, great advice about just always keeping focused on the patient, for sure.
And that's when we go back to Scott's advice at the top of how to know it's time to move to a different place.
Yes,
After one of those lively conversations.
Right.
Well, it's not going to work out with cardiology here. On to the next stop. But I think you also bring up a great point there. I think something that fresh out of residency, you might not be really thinking about being tracked with some types of metrics, whether it's like certain hospital standards, certain patient care standards, or maybe like throughput standards, depending on the groups that you might be practicing in. And then that's one, to just recognize that that's a thing that really does matter on some level to your career. And then also, as you described, that tension maybe on the individual kind of patient encounter and not letting that totally predominate. Was that a real struggle those first few years for you? And was that something that you really how did you center yourself in those moments?
I think that there's this emphasis on regardless, I think all ER doctors have some sort of feeling of needing to be like, hey, I need to be able to move patients. See, it's it's something that I think we do, but in the community, it is, obviously, it's a business and metrics are emphasized. And so when you get out, you don't want to be like, I don't want to be the slow guy. Like, I don't want to be the person that kind of hinders things along. And so when I at least first started, that was a emphasis that I think I negatively brought onto my care, where when I started, I'm like, hey, I want to be able to say, hey, I got started here and I made a big impact and I'm able to, move patients and it caused me, I wasn't thinking about it in the right way. I wasn't thinking about, hey, I want to be efficient because I don't want that patient in the lobby to be waiting any longer. I was thinking of it as more of an internalized way of like, I want people to think good of me. Like, I want people to think, oh, Adam can move patients and be efficient, and bring, revenue into the group. I wasn't thinking it patient-centered. And if you miss that lens, if you're not looking at your metrics from the patient-centered standpoint, I think so much negative things can happen, and a lot of your career satisfaction, can be I think, really affected. So I started out of the gates kind of initially being like, oh, I want to do this, but then I quickly realized that I'm like my care, I wasn't, really having the conversations that I found really impactful with patients, and then you realize, you kind of find where your safe spot is, but as you get better and know the system, you just naturally you'll get faster, and so you don't have to force it. You don't have to force and be like, I need to see all these patients. You can kind of just practice the medicine that you're confident in and that you feel like is a good metric for you, and then take whatever the metrics that come in, and it might be shocking or it might be nice, whatever it is. Then you look at your care and say, hey, how can I improve? And then you ask your colleagues too. Like we have a couple people in our group that are just insanely fast. And I ask, like, dude, how do you do this? How do you chart? I'm terrible at charting on shift. And like some people leave after seeing all these patients, like, done with charting, gonna go, I'm like, I'm the one after shift charting still for several hours. And and that's still a working process, and who knows if I'm ever gonna get it right. But
tune in 3 years from now.
Yeah, exactly. I'm definitely not the person to have on to talk about efficiency with charting. But I think making sure that when you start out, don't let those things like affect how the patient in front of you, I think are really, really important.
That's such a beautifully stated and poignant way of thinking about it, because I think at least in most of residency, the feedback that you get is some sort of qualitative, like how you did, read more, that kind of stuff. And I think some of that is easy to internalize in some way because it's about you and like you're trying to do it in a healthy way to continue growing as a student, as a physician, and all that good stuff. But really, it takes like a lot of like introspection and self-honesty to find that point where you realize like, I am thinking too much about where I am on a forest plot of the people that I work with, and like I really need to focus on what this means to me and these people, and to live with that. So that's amazing that you had that journey right out.
Yeah, I don't know. The first 6 months, at least for me, was like the time where, you're just obviously you're a new system, meeting all these new people, but you just want to make a good impact. You want like everyone wants to make a good splash when they join a group, and especially if you're joining a group where, you're you're surrounded by colleagues that are really just, honestly champions of emergency medicine, and so you want to make sure that you can kind of hang, but you never want that necessarily to negatively affect, your care. And, for me, when I was really just trying to move too fast initially, I just wasn't really, I really wasn't really having the connections that I wanted to with medicine. And I left the shift being like, oh man, I feel like I knew, there are some patients where like, you knew that they had a couple of questions in the chamber, but that you're like, oh, I got to keep moving. And you kind of look back on those shifts and be like, you know what, could I have taken 30 seconds to answer this person's, question? Like, yeah, and they would have had a much better, impact. You give so much more quality of care, so, for me, the gaining of other efficiencies and really making sure that I'm efficient in work, I just wanted to make sure whatever that did, it didn't carve out what I valued in medicine. And really what that was being with the patients and really knowing that I'm giving them my best.
Doing that whole doctoring thing.
The doctoring thing. What we signed up for.
And, Scott, I'm fascinated to hear your opinion. As somebody who at this point in your career is probably like on the back end sometimes now of like trying to make sure this whole hospital system here staying afloat and the group's doing okay and all that, is that kind of a typical journey that people go through of like encountering some of these like care standards, metrics, things that in residency they might not have been exposed to, and like how you'd hope someone to come to like, yes, some of these things are important, but really the care that I'm providing with the time of the patient is what matters the most.
Yeah. I mean, Adam, you said it wonderfully. I mean, I think as a leader, as a CMO, as a director of a site, I mean, that there's a bell-shaped curve around your team, and everybody on that bell-shaped curve tends to bring something different. Mm-hmm. And what you want to make sure is you just don't want to make sure that bell-shaped curve is so wide that there's egregious things happening on either end. I've got someone seeing 4.5 patients per hour, but everybody's going upstairs and upgraded to the ICU in 2 minutes, right? Versus there's someone who's just struggling for whatever reason on those outliers. And then everybody else on that bell-shaped curve, you use the metrics, hopefully, to kind of give you a microcosm of how you're practicing at any given time compared to those people who are practicing in the same environment. Mm. And so if it's done positively, you can then go and say, well, hey, I wonder why Zach is able to do this and I'm not. Yeah. I'm going to go talk to Zach about it. Yeah. And then that helps kind of narrow that bell-shaped curve as well. But it does get very, very difficult for us not to get lost in the metrics and forget that there's a patient, behind all those. And I think you said it wonderfully. And if we could have everybody think that way, my God, if it just would be incredible.
There it is. That's
all.
I
was going to say that's
boom.
That's
drop the mic.
difference.
Drop the mic.
It's I mean, it's something that I personally have. I mean, we worked so hard to get where we're at, in our careers, and really, I think when we first got into med school, you read. Have you guys ever looked back on your application, your statement of your application? It's almost hilarious when you look back, but you realize, I'm like, hey, there was a lot of the heart behind that of being a physician is really like why we all went into the business. And, if you there's so many distractors, but if you allow those things really to chip away and really affect the whole reason why we went into this career, it's really unfortunate. And honestly, you're practicing the best medicine when you are happy, with not only how you are as a physician, as a person, and, you're happy with, that you're giving the patient the best quality. But, it's just something I found helpful.
Yeah.
There's nothing left to say.
Yeah.
That's the attending that every nurse wants to work with. That will inspire a team.
I will, just to change the subject, I will say from a standpoint of another thing that I found challenging. And I tend to be I don't like to make a lot of waves just in general as my own like personality. And so you'll,
I mean, you let us all pronounce your last name wrong for like 4 years. So that's a type of kindness we see.
Oh, it's to each his own.
At your wedding, I was like,
it's to each his own. I think that there'll be times in especially early on and even throughout your career where you have to balance the confidence in what in your knowledge, and your confidence of what you think is right for the patient, but also being open-minded with maybe other ways to practice medicine and care. because there have been many times in my early points of my career that I'll know, you have a hospital, it's like, I can't, like, it's trying to block an admit, and obviously there's always this back and forth, but there are some times where, like, I've been on the other side of being wrong. I remember I was just, last year I was about to intubate this person, where I'm like, absolutely need to be intubated, Pickwickian, worsening gas, like essentially like snoring, somnolent, and I'm legitimately at bedside about to push meds, and the intensivist walked in and he's like, oh, don't intubate. And I'm holding all our gear, everything's ready, and I'm like, you really gonna intubate this train wreck in 30 minutes, in an hour? Like, you want that? Like, I took it from a perspective of kind of me, almost like my pride and I'm like, hey, whatever, you want to deal with it. And I followed up. I mean, the patient, he turned around with BiPAP, and I saw the intensivist, a couple days later. I'm like, dude, that person turned around, and he talked to me. He's like, hey, honestly, like, it could have been a flip of a coin, but I was going to watch him really closely, and I was comfortable with being right at bedside for 30 minutes, an hour. And I mean, the guy was a great doc, and I learned a lot. I'm like, hey, dude, he turned around this patient and avoided intubation. And so you'll learn things, from other people and other disciplines, as well. But it's balancing, because sometimes you'll be asked to discharge things that shouldn't be discharged, and just knowing that you should have confidence in those things as well, and finding that where that metric or where that meter is a constant, obviously, work and challenge. But, that was at least one of the other things that I thought, early on, that was hard for me.
Definitely. Kathy, what do you call it? Terrified pride?
Terrified pride. I love that.
Yeah. I think that is such a good summation.
Yeah.
And I think it's also, at least like when you're working with residents or you're in an academic setting, like, you're supposed to be the person with the answers now. And I feel like early on you might falsely feel that pressure as if, like, you should have most of the answers, even though I think for me, the last few years have been the most exponential of learning, because you have to make those decisions on your own. Or now you really, when you're calling the intensivist, it's not like the MICU fellow who you're just trying to, like, give sign out to and, like, get on with the rest of your shift. It's like, yeah, I have, like, a legitimate question I'd like to ask you about, and you're the only other person in the hospital here overnight. What do you think about this? And it's like a totally different collegiate conversation. And if you don't kind of keep your mind open for that learning, those are, like, from your patients and from those colleagues, that's like your main opportunities now, at least I found in the clinical space. We don't have unlimited time here tonight, unfortunately. So I was hoping I can go around and ask each of you, what is one thing that you really, if people going to their first attending job tomorrow could know, what is the one kind of piece of wisdom you'd want to impart onto them? It could be something as simple as, like, bringing extra Cliff Bar to some of those shifts, or make sure you're withholding some of that stuff on your 1099 so that there's no surprises at the end of the year. I don't know, does anyone feel an urge to maybe go first? Got something off the tip?
Yeah, I'll go first.
All right.
Get there early.
Okay.
I'm sort of the view when you start a new job that you should just kind of put your head down and like work, and not complain, and not be just be that worker bee, the person who accepts some trades, does trades with people, like the good citizen in the group who's willing to help others, and just like when you're sitting in the faculty meetings or the group meeting, like, just listen, and just absorb, and just be a good citizen, absorb things, and you'll have your time down the road to speak up about things that you think might be that could be changed, or might be done differently. But at the beginning, you have to earn that credit. You're new to the group, you don't have an established reputation as much as whatever you were in residency before. You kind of, like, the slate is clean, you have a fresh start, and just be a good worker bee for a while. And then you can kind of come up later. As the scheduler in my group, I would say just, you don't need to complain right away. Yeah. Like, you'll get your chance.
Yeah.
That's great.
I like it.
Maybe send a few drinks to the scheduler person if you know them too. Maybe it's a tough case.
Because sometimes there's, like, subtleties to how groups are and things, and you just like be part of the culture for a while, and just watch and observe and absorb, and then like start asking your questions a little bit down the road.
Yeah.
Kathy, do you have anything you'd want new attendings to know before you have to catch them on shift?
I would say, again, just Introduce yourself. Just introduce
Can you
yourself.
just introduce yourself?
Yeah, exactly.
Who are you?
Yeah.
I want to know what that one attending who didn't introduce herself did. You know,
That's right. No, introduce yourself and give us a human story. Tell us about your puppy if you want. Like, where are you coming from, and what do you need from us, and so that we can step up, and we know where to fill in gaps. And again, the nurses want to be part of the team, so you say that, and we'll kind of gauge where you are in your knowledge base, and don't be afraid to ask. And you do have to own your confidence. You can't be shaking in your boots the whole time, or you might lose a couple of us. But if not, no, you just do adulting.
Yeah. Do adulting.
Yeah.
I love it. How about from you, Scott?
I would say, for me, it's do the work before the first shift. For me, I don't want to be with you on your first shift and you don't know where the computers are. You don't even know what a Dragon mic is. You don't even know how to put in an order on a chest pain patient. And I can't tell you how often this happens. Hey, Scott, I'm relocating from New York. I'm showing up on the 16th. Mm-hmm. My first shift is the 17th. Just send me what you got and I'll read through it. I'm a quick learner. Mm-hmm. No, I mean, what you need to be doing is you need to be spending weeks. You get hired early, spend weeks to months understanding the system, ask the questions, go. And for me, it's all about shadow shifts. Mm-hmm. Even if you don't get paid, go do shadow shifts. Do as many until you feel comfortable. And then if you're credentialed, when you're on that shadow shift, say, hey, I'm going to take 1 or 2 patients. Because just those 1 or 2 patients you going through will lead to all those questions, so that when you really hit your first shift, you can do exactly what Jan said. You can put your head down and you can begin working. I mean, you're still going to have to learn, but the basics.
Yeah, definitely that colleague on the shadow shift. If you take 1 or 2 of those, they're not complaining. They're like, oh, thank God.
Yeah. Right.
It's a single coverage phrase. That's such a good point, and I think especially it's so hard. You just graduated. You're like, finally time to relax and to think about, it definitely takes some time, but like to show up early, to work hard, and to get those like reps in, so on the first day, like you would have studied for your surgery rotation before you came on.
Right.
It's going to be a different game, and you should really know some of those rules before you show up. Yeah, it's a really good point. Adam, any other sage words of wisdom?
I guess I kind of going off of what Kathy mentioned. So my mom is a nurse. And I still, remember when I was going through med school, she's like, if I ever hear a story or anything about a nurse ever having a complaint, I'm going to murder you.
This explains so much.
Yeah. No, I honestly think the team environment of what we do is so important. And at least what worked for me, and a lot of it just because my baseline anxiety, I'm new, help me, but I mean, when I started, you just go, whoever your team is with your nurses, obviously introduce yourself, but I straight up told people, like, hey, I'm new, I'm just getting started here, let's, we're going to work on shift. And after every single, I saw the patients, I would kind of try to individually kind of round with each patient and with the nurse and trying to get as much face time as I could with whoever I was working with, and they're gonna help you so much. Just get your roots implanted and your feet on the ground, and being really kind of learning and being more efficient in that shop. So like knowing your team, being humble, saying that you're new, being an open book, learning a lot, asking questions, and I think just the biggest thing is just be kind to other people, be kind to yourself when you make mistakes. Obviously, be kind to patients. But yeah, it's a beautiful thing. Honestly, the transition after training, into attending hood is special.
Yeah.
Can I do one more?
Yeah, please.
Yeah. I just thought of one while you were talking. That was like, I should say this, which is ask for feedback. Because, as a resident, there's so much feedback, like there's built-in feedback cycles. But when you're attending, there's no like mandatory feedback. I mean, the kind of feedback you get is usually when you're on the high or low end. Yeah. But like voluntarily ask for feedback to the nurses, to the medical director, am I doing okay? Because, honestly, sometimes, people are just working, going along, but how much it would help you to know that you're doing okay. Asking the nurses, you know, is there something I could do better? Is there something I could improve upon? You know, just to ask, and then just shows your humility.
Yeah.
It'll make you feel better. Don't be afraid to ask for feedback. It's not weird.
Yeah.
That's right.
Yeah,
We
it's
were-
true.
It's not at all. And that's such a great point, because I think kind of one of the other themes you're talking about all night is like you're on this conveyor belt med school residency now. And it's like now the world is, you're just a person.
Yeah.
You have a job.
Yeah.
And you just do that thing. And sure, you can have other career goals that continue to advance, but like where you go as a doctor and your identity and how you progress are totally up to you. So if you're not asking for that feedback, you're really flying blind in a lot of ways. And you know, we talk about being like an adult learner in residency, but really now it's like entirely up to you.
Yeah.
And nobody cares, you know, like no one's going to be like checking, hey, I noticed you ordered the wrong dose of this anymore. Like a pharmacist will call you if you're egregiously wrong, but you know, it's up to you to kind of keep up with all those things and to continue to define your identity. I think that could be the hard part, the existential kind of crisis. I think you mentioned a little bit at the beginning. You're like, what do I do with my time and who am I? And you wake up in the morning and you're trying to figure that out. And, you know, and I think that there's no easy solution to that, but like actually taking the time to put some energy into that amidst all of this is so crucial. Well, thank you guys for being here with us tonight. And thanks for sharing all your wisdom,
It's been rad.
Pleasure.
Absolutely.
and all the stuff, academic, community.
Yeah.
We got the nursing perspective. Adam just be pouring our hearts out. You know, that was wonderful. Thank you. And you know, we didn't even talk about like the knowledge acquisition part of things, but hopefully if you're watching, you've been with Emergency Medicine Reviews and Perspectives EMRAP for some time. If you've been with us as a resident, you'd be happy to know that we're still here as an attending. And now actually that CME stuff we talk about, that also matters, and you got to like track that. And it's important. You know, your medical boards will be asking. And we'd love to have you stay on as a subscriber. We do a bunch of free events and stuff, but we will send out a discount code actually if you're previously an EMRA member to get that first year at a huge discount. And then hopefully we'll continue with you on this journey where you need to continue to learn stuff, know stuff on the site. We got the podcast to keep you up to date. We've got a whole video review series, got the HD video. We've got, if you're looking to stay up to date with papers, we've got EMA, or Emergency Medical Abstracts, which just really will go through all the cutting edge literature for you in bite-sized chunks, because we all know that you don't like reading. You know, nobody likes reading. And then, of course, we have our Corpendium on shift guide for, you know, now you're no longer looking up stuff in the bathroom, afraid to present to the attendant. You're just in the chair by yourself looking stuff up. And come join us for that sense of community too. We have these great live events every month, these grand rounds. I think that was the thing I missed most about, like, you know, kind of being out there a little bit. And I know in fellowship you still have a community, but if you're just totally working shifts, it can feel a little bit, I think, where am I in this world of emergency medicine? And we'd love to join you for your ride, and hopefully a long and successful and wonderful career. So thank you guys again for joining us. And you don't see all these wonderful people here at the studio behind the cameras and the sound booth, but we have a whole team of production folks that make this possible, and we couldn't do it without them. You couldn't get the stuff without them. So yeah, a little round of applause for all of them. It's great. Thank you for making this happen. We'd love to see you. If you want to see more stuff, down in the doobly-doo below, link, subscribe, hit the bell, all that fun stuff, and we'll see you next time. Thank you very much. Have a great night.